Hi all, so in this video we're going to see about examination of motor system. So this video is especially meant for first year MBBS physiology practical examination. So this will help you to revise how to examine each of the systems. Mind you, there might be institutional variations or minor variations in the examinations before which you will have to adhere to what is being taught to you. I'll be just covering the general guidelines so that it will help you to revise how you examine them. Okay, so let's start. So first, in order to write a performer for examination of motor system, you have to write about the general examination. You have to write about the higher mental functions because we are going to examine the central nervous system. So whatever is asked of the central nervous system, you should write about the higher functions also, and then move on to the examination of motor system. So in examination of motor system, the first point that you have to note is the bulk of the muscle. Then we've got the tone of the muscle, and then strength or power of the muscle. And then you have to check for the reflexes, coordination of movement, involuntary movement, and gait. So these are the 7 points that are included in the examination motor system, of which reflexes will be discussed later, or it's already been posted. So in this video we'll be discussing about this first part, that is bulk, tone, and power of the muscle. Okay, so let's start. How do we check the bulk of the muscle? So the basic principle is we find out the bony prominence, and from there we measure the distance to the midpoint of that particular part. So for example, if we are going to measure the bulk of the thigh muscle from the patella, which is a bony prominence, you're going to measure a distance such that it is almost the midway of the thigh, or where you have the maximum belly of the muscle. And at that point we have to take the circumference. Okay, so from a bony prominence we have to measure a certain distance, and at that point you have to take the circumference. So like that you can measure the bulk of the muscle. So see, measure the limbs of circumference at specific points using the tape and using the fixed bony prominence as a reference for consistency. So if it is a lower limb, you can check the bulk using patella as a bony prominence. You can check the bulk of the thigh as well as the calf. For the upper limb, you can use olecranon as the bony prominence, and like that you can check the circumference of the arm and the forearm. Usually it is just the arm. So like that you can get the bulk for upper limb as well as lower limb. So you should know in centimeters what the amount was, what the circumference was. Okay. Next is tone. So a very favorite question for examiner is define tone. So what do you mean by tone? Tone is a mild degree of tension or partial state of contraction found in normal healthy muscle. So that is meant by tone. It is a mild degree of tension or partial state of contraction. So now how do you check for tone in the upper limb and lower limb? So to check for tone in the upper limb, what you can do is this movement. That is, you can first hold the subject's hand as if shaking hands like this. Okay, and use the other hand to support the elbow like this as shown in the figure. And then you can assess the tone at the wrist and elbow through supination, pronation, and flexion extension movements. So first hold it as if you're going to shake the hand, and then give a supination, pronation movement at the wrist and flexion extension, and then at the elbow joint also you can do the flexion extension. So like that you can check the tone of the upper limb. Remember, you have to do it on both the upper limbs, both right and left upper limb. What about lower limb? How will we check for the tone of lower limb? For that, we can ask the subject to be in the supine position, and then you can roll the leg from side to side. See, you can hold the leg like this and then just roll it from side to side. Okay, so when you see the angle at which the feet is moving, you can know whether it is hypertonic or whether it is normal. Now another method to check for the tone in the lower limb is by briskly flipping the knee. See, you can just hold the knee like this and briskly flip the knee into the flexed position. So when you do that, you can observe how the feet is coming down. So that is one more method by which you can check for the tone of the muscle. One is leg rolling and other is flipping the knee, right? Now third one is the power of the muscle. Now for power of the muscle, we've got the grading. So we'll see what the grading is. So grade 0 is no contraction. Grade 1 is flicker of contraction. Grade 2 is active movement after gravity is eliminated by suitable positioning, which means that the muscle cannot contract against gravity. For example, moving the upper limb in the upward direction, that is not possible, but moving to sideways is possible. Okay, so active movement against gravity is not possible in grade 2. In grade 3, active movement against gravity is possible but not against examiner's resistance. So against gravity, so the upper limb, now the patient can move the upper limb upwards, but if you give a slight resistance, the hand will again fall down. So that is active movement against gravity but not against examiner's resistance. Now grade 4 is active movement against mild or moderate resistance offered by the examiner. So in this case, even if the examiner exerts a mild or moderate resistance, the person can hold it. However, if full resistance is given, then the patient cannot move against that full resistance. Okay, so that is grade 4. Now grade 5 is normal power, which means that movement against full resistance is possible. So this is the grading of power. So once we examine the muscle, we are going to grade, we are going to see what the power is. Okay. So now we'll start examination of muscles of upper limb. So starting from the fingers, we've got the first muscle is the abductor pollicis brevis. So to examine for abductor pollicis brevis, we ask the subject to abduct the thumb at a right angle to the palmar aspect of the index finger. See, here the thumb is moving in an upward direction, which means the plane of abduction is perpendicular to that of the plane of the palm. Okay. So you ask the subject to abduct the thumb in a plane perpendicular to that of the palm, while the examiner is going to apply resistance in the opposite direction. Okay, so see, the basic principle of examination of power is the patient will try to do the action of that muscle. Okay, so for example, in this abductor pollicis brevis means the action of the muscle is to abduct the pollicis, that is abduct the thumb. Okay, so the patient just have to do the action of the muscle, abduction of the thumb, but the examiner will try to oppose it. So examiner will give resistance in the opposite direction, right? So here the patient is going to abduct the thumb at right angles, while the examiner is going to apply resistance in the opposite direction. Okay, so see, once you apply resistance, we are going to observe and feel for the muscle contraction. You can see the muscle being taut there. So that is how you will examine for abductor pollicis brevis. Next one is opponent's pollicis brevis. So in this case, what is the action of the muscle? It is the opponent's muscle. So ask the subject to touch the thumb with the little finger. Okay, instruct the person to touch the tip of the little finger with their thumb. And what will the examiner do? Examiner will apply resistance against this movement. Okay, so that is how we will test for opponent's pollicis brevis. Now next muscle is the first dorsal interossei. First dorsal interossei. So what is the action of the first dorsal interossei? Remember, we've got a mnemonic called PAD and DAB, where PAD is for palmar interossei adduction and DAB is for dorsal interossei abduction. So the action of the first dorsal interossei is to abduct the index finger. So ask the person to abduct the index finger. Okay. Whereas what will the examiner do? Examiner will apply resistance. He will not allow him to do that. Okay. So we apply resistance against that movement. Remember, you are going to apply the resistance on the outward aspect of the index finger while the person is trying to abduct it. Clear? So that is how we will test for first dorsal interossei. Now next group of muscles in the upper limb is the interossei and the lumbricals, the other interossei and the lumbricals. So to test that, you can ask the subject to flex the metacarpophalangeal joint. Which is the metacarpophalangeal joint? This joint here. So this is the metacarpophalangeal joint. You can ask the subject to flex the metacarpophalangeal joint, whereas extend the distal interphalangeal joints. Extend the distal interphalangeal joints. So what happens? So this is one method by which you can examine interossei and lumbricals. But remember, what was the actual function of the interossei? It is abduction, right? So another test is you can ask the subject to abduct the other fingers, whereas the examiner can apply resistance. Okay. So that is how you can test for the abduction of the fingers, because pad and dab. So to test for other dorsal interossei, you can ask the subject to abduct the fingers, whereas you apply resistance. And to test for the adduction of the fingers, you can use this card test. So see, basically in this, you ask the subject to catch hold of a card or a piece of paper like this, and the examiner will try to pull it out. So this is another method by which you can test the intraosteal lumbricals. So remember, one test is ask the subject to flex the metacarpophalangeal joint, whereas extend the distal interphalangeal joint. And for intraosteal, you can ask the subject to abduct the fingers, and for adduction you can test it using the card method or card test. Okay, so that is how you can test for intraosteal lumbricals. Now next group of muscle is the flexors of the fingers. So to test the flexors of the fingers, you can ask the subject to squeeze the examiner's middle and index fingers. See, this is the examiner. The examiner is giving the index and the middle finger for the patient to squeeze. So when the patient squeezes, you can see that the flexors of the fingers are working. Okay, so that is how you'll test for flexors of fingers. So actually the examiner can try to pull out his fingers while the subject has to hold on to it tightly. So that is how you'll test for flexors of fingers. Next group of muscle is the extensors of fingers. So in this case, you can ask the subject to extend the finger while the examiner will apply resistance. You can ask the subject to extend their fingers against resistance with your hands in the prone position. So this is how you can test for extensors of fingers. Okay. Next one is the flexors of the wrist. How will you check for flexors of the wrist? Again, you can ask the subject to flex the fingers. See, this is the subject's hand. You can ask the subject to flex the fingers, which means you have to ask them to bring the tip of their fingers towards the front of the forearm in this direction. You can ask the subject to flex the wrist while you will apply resistance here. Okay, you can apply resistance on that palmar area, in which case you will know whether the flexors of wrist have normal power or not. That is how you will check for the flexors of the wrist. Next is extensors of the wrist. How will we check for extensors of the wrist? So in this case, you can ask the subject to make a fist. See here, you can ask the subject to make a fist and try to extend the wrist, whereas you will apply resistance against it. Okay, so here remember, you have to ask the subject to make a fist and then extend the wrist while the examiner will apply resistance. So that is how we'll check for extensors of the wrist. So that will complete our muscles of the hand. Now we are moving to test the power of muscles of the forearm. So the first muscle that we are going to test is brachioradialis. So to test that, you can ask the subject to position the forearm midway between prone and supine. That means in a mid-prone position. Okay, so see here, the person's hand is in a mid-prone position. Okay, and then you can ask the subject to flex the forearm at the elbow joint against resistance. So first ask the person to place it in a mid-prone position, and then you ask him to flex it against resistance. So that is how you check for brachioradialis. The next muscle that we have to check for power is the biceps muscle. So to check the power of the biceps muscle, we can ask the subject to position the forearm in the supine position. Remember, that is the difference between examination of brachioradialis and examination of biceps. In brachioradialis, the position was mid-prone, whereas in biceps, the position is supine. Okay, and then rest is the same. You ask the subject to flex the forearm at the elbow joint, whereas you apply resistance. So remember, the person's hand should be in the supine position and then flex it against resistance. So that is how you'll check for the biceps muscle. Next, we have to check for the triceps muscle. So to check what is the function of triceps, it is extension, right? So in this case, you can ask the subject to straighten their forearm against resistance. So see here, the person is trying to straighten the forearm while you apply resistance here on the outward aspect. Okay, so remember, as I repeatedly say, the basic principle is you ask the subject to do what the function of that muscle is. So for the function of triceps is to extension. So ask the subject to extend the elbow, whereas you try to resist it. Okay. So the next muscle that we're going to check is the supraspinatus. So we know that supraspinatus is responsible for the first 30 degree of abduction. Okay. Rest 60 degrees by deltoid muscle. So here you can ask the subject to abduct the arm, the first 30 degree. And then while the person tries to abduct the arm, you can apply resistance. Okay, so that way you can check for the supraspinatus. Remember, you have to apply resistance at the beginning itself, because only the first 30 degree is by supraspinatus. The rest is by deltoid muscle. Okay. So the next muscle obviously is deltoid muscle. So to test the deltoid muscle, we said that the rest 60 degree of abduction of the arm is by the deltoid muscle. So you can ask the subject to abduct the arm like this against resistance. Remember, the angle is important. First 30 degrees by supraspinatus. That is why we apply resistance as soon as the person started abducting. But here the angle is different. Okay. So up till 90 degree, the abduction of arm is by the deltoid. So you can apply resistance here while the person tries to abduct his arm. Okay. Now remember, deltoid has got anterior and posterior fibers also. So to test for the anterior and posterior fibers, you can ask the person to draw the abducted arm forward. So see here in this diagram, the person is trying to pull the arm forwards, whereas the examiner is trying to resist it. Okay. Whereas the posterior fibers are going to draw the abducted arm backwards. So in this case, the person is going to swing his arms backward while the examiner is trying to apply resistance. So to test the deltoid, you've got 3 steps. First, you have to apply resistance between the 30 to 60 degree of abduction against resistance, and then to test for the anterior and the posterior fibers, you have to ask the subject to ask them to draw the abducted arm forward against resistance to test for the anterior fibers, and draw the abducted arm backwards to test for the posterior fibers. Okay, so that will complete examination of deltoid muscle. Next, we have to test the infraspinatus muscle. Now, this is a little tricky. In this case, you have to ask the subject to hold their elbow firmly to the side. Okay, so you can see that their elbow is placed firmly to the side of the body. Okay, the forearm is flexed at right angle, and then you ask the subject to move the forearm in an outward direction. Okay, so here you can see that the person has held his arm or elbow close to the body, flexed at the forearm, and then you ask the subject to move the forearm outwards, okay, in a swing like manner. At that time, the examiner will apply resistance. So with the examiner facing the subject, instruct them to rotate the limb outward against resistance, and ensure that even when they are rotating, the elbow joint must be close to the body. The elbow joint must be close to the body. Okay, so the forearm will be moving in this direction, in an outward direction. So this is how you have to test for infraspinatus. Remember, students usually tend to forget this because the method of examination is not that direct when compared to the other muscles. So here you have to ask the subject to hold the arm close to the body, elbow close to the body, and then outwardly rotate the forearm while the examiner applies resistance. Okay, so that's how we'll test for the infraspinatus muscle. Next major muscle is the pectoralis major. So to test for the pectoralis major, you can ask the subject to stretch their arm forward and clap their hands together. You see, stretch the arm forward and try to clap the hand, but you're going to apply resistance. See, you're going to apply resistance here, okay, at the forearm. So the person, you ask the subject to try to clap their hand while you apply resistance. So that is how you will check for the pectoralis major muscle. Next muscle is the serratus anterior. Now this might be familiar to you because we've learned about winging of scapula and all. So to test for the serratus anterior, you can ask the subject to push forward with your hands against a wall. Ask the subject to push against a wall. In that case, if there is a paralysis, you can see winging of scapula. The medial border of the scapula will be more prominent in case of winging of scapula. So that is how you will test for serratus anterior. Just ask the subject to push against the wall. Now the last muscle of this group is the latissimus dorsi. So to check for the latissimus dorsi, you can ask the subject to clasp their hands behind the back. Ask the subject to clasp the hands behind their back. And when they try to do that, you have to apply resistance in the downward and backward movement. Remember, in this case, the examiner will be standing behind the subject. Okay, so the patient is trying to clasp the hand while the examiner will apply resistance in the downward and backward movement. Okay, so that will complete examination of power of the upper limb. So far we've seen abductor pollicis brevis, opponens pollicis, first dorsal intraossei, intraossei and lumbricals, flexors of fingers, extensors of fingers, extensors of wrist, flexors of wrist. And then we went on to the forearm, brachioradialis, biceps, triceps, supraspinatus, deltoid, infraspinatus, pectoralis major, serratus anterior, and latissimus dorsi. So remember, in upper limb, we have to examine at least 17 group of muscles and then finish it off. Okay. So examination of motor system is not complete here. We have to examine the muscles of trunk, muscles of lower limb, coordination, etc., which we'll see in another video. Okay. So I hope this much is clear for you. Thank you.